Well, hello there and welcome back. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach nursing concepts and share tips on how to thrive in school and at the bedside. I'm really excited about this fun episode today. I've done these in the past, and they're always so popular, and that is the PodQuiz. So we'll be doing a PodQuiz today. In fact, they have been so popular, I made a whole separate podcast almost entirely devoted to PodQuizzes called Study Sesh, which I will put a link to in the episode notes and talk to you about more as we get to the end of this episode. Now, I do want to take a quick minute for a listener shout out before we dive into our pod quiz. And this one goes out to Brian, who is a student in my boot camp. And guess what? Boot camp's on sale right now. So here's what Brian had to say. Just wanted to share how amazing Straight A Nursing Boot Camp is. He's talking about Crucial Concepts Boot Camp. I've made it through the first month of school and have 100s across the board. I'm so proud that I'm making this work. Thanks to the skills and tips I picked up during boot camp, I feel my day-to-day is super organized, planned out, and doable. I'm even maintaining a sleep schedule. Anyway, if you haven't checked it out, do it. So a big thank you to Brian for sharing his experience with boot camp, and that is on sale right now. And if you go to the checkout page and you check out, and then it gives you an opportunity to add on Study Sesh, take it, because it's basically getting both programs on sale. It's a discounted offer that you're presented to one time when you get to your checkout page. Grab Study Sesh. It's full of these pod quizzes. And if you've never done a pod quiz, you're going to love it. Let's dive into one right now. And the pod quiz topic we're going to be going through today is medical terminology. So whether you're a brand new student heading into school, or you just want to feel more confident so that you understand things in clinical and in lecture, this pod quiz is for you. So here's how it works. I will ask a question and pause for a little bit to give you time to think of and say the answer. I don't care if people look at you like you're silly. Say the answer. It really helps it get into your brain. And then I tell you the answer. So even if you don't know it, you still get the right answer. So it's a great way to test your knowledge and review and learn. So let's dive into it. What is thoracentesis? That is removal of fluid from the chest. This is often done with a pleural effusion. And guess what? I just recorded an episode on pleural effusion. It will be released next week. So that's thoracentesis. What is hemoptysis? That is spitting blood. Usually that means the patient has a problem with the lung, and many times it's because of something like lung cancer or tuberculosis. What is hematuresis? That would be the condition or the state of someone who is urinating blood. What is dyspepsia? Abnormal digestion. That prefix dysp means something's abnormal. Dysrhythmia, dyspepsia. You see what I mean? It's abnormal. Dyspepsia, dysrhythmia. What is oliguria? That is a scant amount of urine. You might see this in an individual who has acute renal failure or chronic renal failure, and they're just not putting out very much urine. What is encephalitis? That is inflammation of the brain. What is tachypnea? That is an elevated respiratory rate. Good job. What about sanguineous? What does that mean? That basically means it contains blood. You're looking at sanguineous drainage. It's going to be very bloody drainage. What is vasospasm? That is a spasm of the vessel. Vaso means vessel. What is retroperitoneal? That is behind the peritoneal space. Retro means behind. What is myocardium? That is muscle tissue of the heart. What is hypercortisolism? That is a state of having too much cortisol. So hyper means too much. Ism means state of. This is a state of having too much cortisol. What is a pulmonologist? That is a lung specialist or one who studies the lung. Ology or ologist refers to study or specialization, and pulm means lung. What does nephrotoxic mean? That means something is toxic to the kidney. Nephro refers to the kidney. What is a cholecystectomy? That is a surgical procedure to remove the gallbladder. So ectomy refers to removal of something. And that first part, cholecyst, refers to the gallbladder. What is a pneumonectomy? That is a removal of the lung. Again, ectomy is removal and pneumo refers to the lung. What is angiography? That is visual imaging of the vessels. What does ipsilateral mean? That means on the same side. You'll often see this mentioned when you're learning about a patient's stroke symptoms. If they are ipsilateral, that means the symptom is on the same side as the stroke occurring. So if they have ipsilateral visual loss and the stroke was on the right side of the brain, that means they would have visual loss on the right side. What is dysphagia? That is abnormal swallowing. Again, very common to come across this term when you're working with stroke patients. What is endocarditis? That is inflammation within the heart. So endo means within, card refers to the heart, and then itis refers to inflammation. What is rhinitis? That is inflammation of the nasal passages. So itis is inflammation, and then the rhine part refers to the nose. What is rhabdomyolysis? That is the breakdown of muscle. It's a condition where the muscle is broken down. So myo means muscle, rhabdomyo, a specific like striated muscle, and then lysis refers to breakdown. What is enterovirus? That is a virus of the small intestine. Entero refers to the small intestine. What is an arteriogram? That is an imaging study of the arteries. What is hydrocephaly? That is elevated water, or CSF, in the brain. Hydro refers to water, and then ceph, CEPH, refers to the brain. What is atherosclerosis? That is hardening of the artery. So sclerosis means hardening, and athero refers to the artery. What does neoplasia mean? That is the formation of new tissue. Neo means new. What is a urostomy? That is an opening that is created to allow the passage of urine. If the patient had a colostomy, that would be an opening to allow the passage of stool from the colon. What is apraxia? Apraxia means essentially without movement. The person has an inability to carry out a familiar and purposeful movement. They can also have apraxia of speech as well. Hyponatremia. That is a low sodium level. So hypo means low, and natremia refers to sodium. What does polymorphic mean? Multiple shapes. What are megakaryocytes? Those are large cells in the bone marrow. Mega means large. What is hypoxia? That is a low oxygen level. Oxia refers to oxygen. What is hemolysis? That is the breakdown of blood cells, specifically red blood cells. What is bacteremia? That is the condition of having bacteria in the blood. Emia refers to the blood. What is cardiomyopathy? That is disease of the cardiac muscle. What is a pan culture? Pan, pan culture. That is basically when the MD wants to culture everything possible. Get as many cultures from the patient as you can. That would be urine culture, blood, sputum, wounds, all of the things. What does periumbilical mean? That is the area around the umbilicus. Peri means around. What is quadriplegia? That is paralysis of 4 limbs. So plegia refers to paralysis, and quad refers to 4. What does epigastric mean? That means above the stomach. Epi means above. And of course, gastric relates to the stomach. What is rhinorrhea? That's flow from the nose, basically a runny nose. What is venography? That is a radiograph of a vein. Remember, VEN refers to veins, venography. What is cardiorhexis? That is a rupture of the heart wall. Cardio refers to the heart, and rhexis means rupture. What about the term aphasia? What does that mean? That means without speech. Very common assessment finding in patients with stroke. What is a sympathomimetic? That is a drug that mimics the sympathetic nervous system. Anytime you see mimetic, it's going to be mimicking. What does necrosis mean? Death of tissue. You'll see this when you're talking about stroke and brain tissue dying, and in myocardial infarction when heart tissue is dying. What is gluconeogenesis? That is the production of glucose. Gluco refers to glucose. Neo means new, and genesis means to create. So we're creating new glucose. What is a pneumothorax? That is air in the pleural space. What about hyperkalemia? That is an elevated potassium level. Hyper means high. Kalemia refers to potassium. What is paraplegia? That is paralysis of two limbs. So plegia is the paralysis component, and para means two. If I say I'm taking an antipyretic, what do I mean? That means I'm taking a fever-reducing medication. Anti means against, and pyretic refers to fever. What is neutropenia? That is a deficiency in neutrophils, which, as you remember, are white blood cells. So a patient with neutropenia is going to have a low white blood cell count and be at very high risk for infection. What is proteinuria? That is the state of having protein in the urine. What is dysrhythmia? That is an abnormal heart rhythm. Dys means abnormal, rhythm means rhythm. What does intrarenal mean? Within the kidney. So some types of renal problems, renal issues, renal failures will be intrarenal. What about intercostal? That means between the ribs. Inter means between. Costal refers to the ribs. So intra was within. Inter means between. What is a plasmapheresis? That's a procedure where the plasma is removed. So pheresis refers to removal, and then plasma, of course, refers to plasma. What is lipolysis? That is the breakdown of fat. What is hemostasis? That is the control of blood. Basically, you're stopping the bleeding. So when you remove an IV, you'll hold pressure until you have hemostasis, until you've controlled the blood. What is an anxiolytic? That would be something that reduces anxiety. Very commonly, there are medications that are anxiolytics, such as benzodiazepines. What does preprandial mean? Before a meal. So if you're looking at your orders and it says to give a preprandial dose of insulin, that's happening before the patient eats. After a meal would be postprandial. What is cholecystitis? That is inflammation of the gallbladder. Remember, itis is inflammation, and that cholecyst part refers to the gallbladder. What is aortic stenosis? That is narrowing of the aortic valve. So stenosis means narrowing, and in this case, we're looking at the aortic valve. What is ataxia? That is without coordination. What is hemiparesis? That is weakness on one side of the body. Paresis means weakness, and hemi means one side. What is sublingual? What does that mean? That means under the tongue. So sub means under, and lingua refers to the tongue. What about cholelithiasis? That is the condition of having stones in the gallbladder. Technically, lithiasis refers to something being abnormal, and chole is that gallbladder component. So basically, there's an abnormal gallbladder, and in this case, it's stones in the gallbladder. What is hepatomegaly? That is an enlarged liver. So megaly refers to enlargement. The hepato part refers to the liver. What about cardiomegaly? That would be an enlarged heart. What is osteomyelitis? That is inflammation of the bone. So itis is inflammation, osteo is the bone. What is idiopathic? What does that mean? Idiopathic means of unknown origin. So you might have a patient with idiopathic hypertension, meaning we don't know why they have hypertension. They just have it. What does hypokinesis mean? That means decreased movement. What is glycolysis? That is the breakdown of glucose. And what is hematuria? Blood in the urine. Excellent, excellent work. Of course, there are many, many, many more medical terms out there that you'll need to know. But as you get used to knowing kind of those keywords, the roots, the suffixes, the prefixes, you can start kind of piecing things together and figuring things out. So 2 announcements related to the study session that you just went through with this pod quiz is that I cover these things and have a handy little downloadable workbook for you. They're inside Crucial Concepts Bootcamp in the Talk Like a Nurse module. So if you're really interested in getting ready and prepared and setting yourself up for success in nursing school by learning some foundation concepts and some success strategies and tips, then check out Crucial Concepts Bootcamp. It's on sale right now at the time of this podcast being published. Okay, so there's that. And then I also have Study Sesh, which is a private podcast. So it's audio based, where I take you through a lot of pod quizzes covering a wide range of conditions. I believe there's about 109 or 110 pod quizzes alone inside Study Sesh. And then there's drills, there's power hour sessions, and a few case studies. I'm hoping to add some more of those. The majority are the really, really popular pod quizzes. So I will put a link to both of those in the episode notes. You can also always just go to straightanursingstudent.com and click on courses in the top menu bar, and then you would get to it that way as well. Again, if you are getting in on that boot camp sale, when you get to the checkout component, you can choose to add on Study Sesh. And then it would basically give you a little bit of a discount on Study Sesh, which is kind of like getting both of them on sale, which is super cool. So again, go to straightanursingstudent.com, click on courses in the menu bar, check it out. And then I will see you back here next week. I mentioned earlier that the episode coming up next week is on pleural effusions, which happen pretty often. It's a very, very common condition. And when I first started working in the ICU, it was just seemed like almost everybody had a pleural effusion of some size or some kind. And sometimes we had to treat it, and sometimes it could just be watched and it might just go away on its own. But as I learned over time is that the reason so many people had them is so many things can cause them. So we'll be diving into pleural effusion next week. So I will see you back here for that. Bye for now. This podcast is brought to you by Straight A Nursing.